and welcome to the Society with Fatma Shaheen at PTB World. With statistics showing that the global population is reaching 8.1 billion people today, and it is projected to reach 9.7 billion by the year 2050, it is very important to sit back and then analyze that how does overpopulation then impact us as a Pakistani society. And this is something upon which we'll be shedding light during the course of today's conversation. We'll be talking about overpopulation more so from a socialist perspective. We'll be talking about how does overpopulation at a very basic level then not only intersect with education, how it also intersects with women empowerment, gender inequality, with poverty, and even in the larger picture with environmental degradation or climate change, so to speak. In this regard, we'll also be talking about, how we do see the Pakistani government very diligently working so as to curb this very issue, and then of course the very important work of civil society, of international partners, and the need for there to be maximum media awareness about this issue too. We'll also be shedding light upon the fact that when it does come to practically working so as to curb this issue of overpopulation, what kind of challenges do then people come across more so both in the rural as well as in the urban context. We'll also be delving upon the need for there to be policies so as to curb this issue. However, policies then again they come with question marks because we have seen that when countries they have actually promulgated policies to this effect, it is something which has in ways more than one come with a backlash too. Last but not the least, we'll also be talking about this generally in terms of the changing trends that we do see more so in young people, where young people in Pakistan today are now very proactively opting to have smaller families, either because of economic constraints or because of changing social preferences, so to speak. How do we see the trends changing over a period of time? That is also another angle upon which we'll be touching. All of this today, that too with an extremely pertinent panel. Let me introduce you to my today's panel. My first panelist for today's show is Brigadier Dr. Nadeem Mahmood Saab. He's a public health and a family planning expert. Assalamu alaikum, sir, and welcome to the show. Thank you for joining us, sir. Alongside him, I have Ms. Saman Rai. She is the Director General of Population Welfare Department, Punjab, and she's also the CEO of Punjab Population Innovation Fund. Assalamu alaikum, madam, and welcome to the show. Thanks for joining us. My third panelist for today's show is Ms. Saima Murtaza. She is the Deputy Director Programs, PGDP, World Bank, and the Government of Pakistan. Assalamu alaikum ji, and welcome to the show. Thank you for joining us. Now, before we start the discussion on today's topic, let's have a look at this brief report.
As our world grows, so do our communities. Overpopulation, while challenging, also brings opportunities for positive change. Firstly, it highlights the importance of innovative solutions in urban planning, creating more efficient and sustainable cities. The causes of overpopulation, such as advancement in healthcare and reduced mortality rates, underscore our progress in medical science and improved living conditions. Addressing gender inequality becomes a focal point as overpopulation drives the need for equal access to education and employment for all genders, empowering women and strengthening societies. Governments worldwide are stepping up, implementing initiatives to balance population growth with resource availability, ensuring a bright future for everyone. The media plays a crucial role in this effort, promoting sensible family planning and educating the public on sustainable living practices. By raising awareness, sharing success stories, and fostering an informed community, the media contributes to a well-rounded approach to population management. Together, these positive strides show that with the right strategies, we can turn the challenges of overpopulation into opportunities for a better, more equitable world.
Welcome back. We just saw this report. Now, to get the conversation started with you, sir. So, when we do talk about overpopulation, this is something that I mentioned in my introduction as well. We do understand that yes, it is a global issue, and then we also understand that it has economic repercussions too. But talking about this from a socialist perspective, how do you see overpopulation intersecting with poverty, with education, and women empowerment in the Pakistani society?
Actually, population is basically a cross-cutting issue which affects almost all the segments of your life, including the education, the health, the poverty, and every aspect of life. If you see at the independence, the total population of Pakistan was 70 million. Out of that, 30.4 was residing in the west and the rest was in East Pakistan. Now we have population of 242 million people. and it is increasing at a rate of almost 1.8%.
Right.
About 800 babies are being born at every hour in Pakistan. And if you see the statistics from 2023 till 2024, there is an increase almost of 5 million people in the population of Pakistan.
That's right.
Which is almost equivalent to the population of a New Zealand or Denmark. So you can see that each year in Pakistan we are adding one New Zealand or one Denmark into our population. We have to cater for their needs.
Of course.
This is not only the big challenge for the policy makers to plan. With the limited resources and Pakistan being a developing country, this is a big challenge for us as well.
Right. So, for us as a society to see, because you see when there are more and more people, then there is definitely by that virtue scarcity of resources too. Madam, I'll take you on board on that aspect as well. So, when we do talk about overpopulation, we do understand that your department has very diligently been working so as to curb this very issue. But in the course of your work and otherwise, what are the most common myths that you do come across regarding overpopulation? Because a lot of times we hear people saying that in any country, if their population rate, so to speak, is slow, then that in one way or the other would unfortunately impact the economic growth too, and that is something which is not true. So how would you respond to that?
First, I would like to thank you for selecting topic of today's, because no one really talks about population, which is also a big challenge because we are not really understanding the severity of the issue. And as he rightly pointed out, that population is growing at an alarming rate.
Right.
And every day I think new babies are being added into the currently existing population. So we really need to make a very interesting kind of planning and policy making to meet this gradually increasing complexity of the challenge.
Right.
But I think when we talk about the government and the population welfare department, I think historically, if we look at the performance of this department for past many decades, it is working, one, to alarm and to everyone is being sensitized about the growth in population. The second thing is, how do we meet this challenge of growth in population? That is only possible if we can slow down.
That's very rightly put by yourself. But when we talk about the most common misconceptions, the most common myths that you do come across, how would you bifurcate those to be? Because a lot of times we also see that in countries where perhaps overpopulation is overemphasized upon, there is this strata of critics which actually thinks you're focusing too much on issues like these and you're just anti-children. Although on the converse, it would be right to say that yes, of course, if you are working on this issue, you're actually thinking for the betterment of the children of that very country. So how would you respond to that?
Yeah, I think you have rightly pointed out. It is a debatable topic and the complexity lies in its being such a multi-layered topic.
Right.
So there is not a straightforward answer to any question. Are we too few or are we too less? And I think able-bodied population would be a very cherished kind of thing for any government. Because look at other countries, I think like Japan, so they are suffering from aging. Their non-working
Even
age.
Italy.
Their non-working age population is increasing.
True.
The dependency ratio in population is increasing. But look at Pakistan, so we have the youth bulge. So we are relatively speaking in an ideal situation. But are we able to reap the benefits of the youth bulge? It's a big question.
That's
mark.
another debate, madam.
Time is ticking away.
That's right, Ms. Saman. On which I'll come to you, Ms. Simon. I would want you to add to this further. So when we do talk about this more so from an environmentalist perspective, how do you see overpopulation then impacting or intersecting with environment, or for that matter even climate change, so to speak? Because a lot of time we have seen that people just often ignore this very angle. There is a very deep link between overpopulation and how that in turn actually impacts the environment at large.
Well, Fatma, for me, overpopulation and sustainability are two sides of the coin, and they cannot be separated. Focusing on sustainability as a goal will not work.
Right.
Sustainability should be the way of our living, and especially for a country like Pakistan, where already we are resource constrained country, overpopulation is badly affecting the indicators like environment, socio-economic, as well as social indicators. And focusing on indicators like with the increase of population, we are facing a water resource issue, which is we are facing a stress on water reservoirs reservoirs, as because with the increase of overpopulation, we are having more demand of water for domestic agriculture and industrial purposes. And the major issue we are facing right now is every international or national talk, the buzz is the climate change and global warming. So deforestation plays a vital role in it, and cutting up the trees, urbanization, focusing on air pollution, then above all energy. With the energy resources, now we have to rely on other resources like coal, gas and oil, which are not only we going to deplete them, but we are also focusing on air pollution as well.
Right.
Food insecurity, we're having a major setback with food insecurity.
Right, and it's also, you know, if you think about this, like you do remember a few years ago, we did see this very rampant trend of migration, people migrating from one place to the other, that too because of environmental concerns. So that also adds to this burden then. And then of course we also see land fragmentation, which again is an issue I feel which is often overlooked. That is again a consequence of overpopulation.
And Fatma, above all, the major area which is hit is the agriculture sector.
True.
As we the agriculture is the backbone of our country, and with the increase of population, the agricultural land is being depleted. A lot of fertilizer and pesticides have been used to cater the massives, and which are affecting the soil erosion as well as biodiversity loss, as well as again affecting the climate change.
Right.
So we need to look at this in a very holistic way.
That's so true.
That all this are interlinked to each other, and overpopulation is badly affecting the environment indicators, and we should all know that we have one planet to live in.
To which you wanted to add something, sir?
Yes, if you see at independence, the population density of Pakistan, this was around about 50. At presently, Pakistan population density is 308 persons per kilometer square.
And that is expected to increase to 60% by the year 2050.
Yes, and if you see the bigger cities, they are having more burden on that. Like come to Lahore, the population density is more than 7,000 people per kilometer square, and for Karachi it is almost 24,000. So it is quite alarming, because people are migrating to the big cities for various reasons, and that has caused even depletion of the agricultural land which is around those big cities.
Sir, but another aspect on which I would want you to deliberate is the fact that, you know, we have seen that in countries more than one, for example China, we have had policies which have very categorically restricted the number of children that you can actually have. But as an expert in this area, how effective do you feel are such policies in the local Pakistani context that we do live in? Because we do understand then that China also ended up revising this policy to having 2 children, and then in the recent past to even 3.
Every country have to make the policy according to their own environment, according to their own social, cultural, and above that the traditions. So in Pakistan we have to see how far we can go and how far we can implement. And government has very rightly, you know, lately they have adopted a policy of a tawazun, which is a right based, and this gives the responsibility and the available resources, and the families are empowered to decide at their end how much children they want to have.
Right.
They can decide how much children can, or a family number they want to have.
True.
So I think with the present scenario, the government there is very effectively pursuing this, and I must appreciate the efforts by the population welfare departments and the healthcare department, including other private sectors.
Right.
Because in Pakistan, you know, majority of the communities, they are getting the healthcare from the private sector.
Right.
So no, with the collaboration of the government and the private sector, we are able to increase the access of this contraceptive and other family planning methods to the people.
To reproductive health services,
yes,
basically, so to speak. It has to be a very comprehensive and collaborative effort, right?
Yes.
So your point is noted. Madam, coming towards you, I would want you to add to what he just said. So when we do talk about the work of the department, the work of the government, so to speak, so can you please explain to us, for the benefit of the audience, that when we do talk about it, what all does it entail? Is it just limited to providing people services regarding family planning so as to make them more aware, more sensitized about having a big family, or does it also extend to perhaps having more effective media campaigns too?
I think all of it. When we talk about slowing down the tremendous population growth rate, only family planning comes to our mind.
Right.
And family planning policies are adopted all over the world by the governments just to help all the people slowing down population growth rate. And it is not about population only, it is also about leading a healthy life, and also deciding and limiting the number of children and the spacing between one child and another child. And we try to enable all the couples, married couples, to decide about the size of their family as well.
Right.
So he mentioned about the narrative of tawazun and balance, that is bringing a balance between the resources and the family size. But since most of the people are not really aware of this balance in life, we have to, as a government department, sensitize them
Right.
and also enable them to benefit from the services that we offer round the clock free of cost in
Right.
terms of reproductive health services, contraceptives provision and guidance.
That's right, madam. But in addition to that, when we do talk about all these sensitization programs that the government is actually conducting, or even civil society for that matter, do you not feel here that we equally need to focus upon making male allies of such programs to educate them and sensitize them about the nature of this very issue as well?
I think if I talk about departments working, we don't really differentiate between males and females because our services are for everyone. And mostly we work on the married couples and we take family as our unit of focus. But our services are for everyone, so whosoever needs. And we also try to expand our services to meet the unmet need because there are people who really wish to benefit from reproductive health services, but probably they don't have access.
Right. So
or
that's
maybe they don't
another
have
angle that you do
awareness.
cover, and this is something that we do need to highlight so that people do know. On which I'll come to you, Ms. Simon. I would want you to add to this further. So I do understand that in your role as co-chairperson for the Ministry of National Health Services Regulation and Coordination subgroup of Media and Advocacy, you have been very actively advocating for the cause of family planning. So in the course of doing just that, how do you feel can advocacy efforts be made more inclusive and culturally sensitive, that too of different quarters of the Pakistani society, because this is a very social and can also be a very sensitive issue, so you need to take everybody along with you when you are actually advocating for it. So how particularly is that balance then struck?
Well, the government way back in 2018 made it very, very easy for me to advocate as a co-chairperson in a way that the previous line that the focusing on two children was being depleted, and was a national narrative was being based on suo moto, which was balance for better. And again, like previously someone quoted as well, that it's not balance in family planning, but it's balance in life as well as resources as well. So in order to explain it and in order to advocate it, the major focus for me was the youth, because the major bulk of population we are carrying in our country is the youth, 60%, more than 60%, and they spread the message to like a fire. So my focus was to advocate using the youth, as well as we did a lot of media strategies. We planned a lot of media strategies. We involved a lot of TV channels in it. Social media was been a lot
So you basically had a multi-pronged approach.
Yes.
But when it comes to young people, do you not feel that now there's a growing trend of young people actively making that decision to have smaller families, be it because of economic constraints,
Yes.
or be it because of just being perhaps more pragmatic as opposed to the previous generation? So I think that is something for which perhaps we need to give them due credit to.
Yes, we need to give a credit as well, and we should even give a credit to the media as well, because media is playing a vital role in spreading up the message as well. And plus now there's awareness as well among people. This is not only the growth of the family. We're not only focusing on like family planning, but we're also focusing on mother and child health and a healthy mother, proper birth spacing. So advocating was very easy in a way, because we did not made while advocating, I was focusing on not to be judgmental, not to be harsh with the lines, but keeping the cultural and the religious context in view, focusing on more mother health, the child health, increasing the contraceptive prevalence rate, increasing the reducing the fertility rate, and increasing mortality and infant rate.
Right, because
so the focus
everything
was on
is very
that.
deeply
So all the
interlinked,
messages were built up in this way and in a very innovative way. And yes, the story, the success story as a co-chairperson was that every ads, every social media campaigns were being made on success stories of everybody's individual life. We were focusing more on individual life and focusing on resources.
Because you see, then again, this is something very subjective, something very relative. There are people out there who can very easily afford to have perhaps bigger families, but on the contrary, there might be people who can't afford to do just that. Sir, coming towards you, and I think I would want you to add to what she just said. So when we do talk about, bringing about that societal mindset change, one which then focuses on on having perhaps more healthy individuals, more healthy children, as opposed to perhaps just opting and having that son preference, so to speak. How do you feel has the Pakistani society moved past that? Because we now do see that generally, at least in some quarters of the Pakistani society, that son preference that has kind of declined.
We have a big setup of service provision networks. We have hospitals and service delivery points. We are a member associate of International Planned Parenthood Federation, which is a federation of 160 countries. And we have been interacting with all those, and presently we are with the Arab world region, and we are interacting with the Arab countries mostly. So most of them, you know, they are the Muslim countries.
Right.
And the son preference, this is almost in all those countries. But now with the change and with the, in the literacy rate, we have seen that the son preference had somehow is not given that much of priority.
That's right.
Because now the families, they understand that the girls, they are equally empowered, they are equally educated, they can equally contribute.
And they are equally celebrated too, basically.
Yes.
And I feel for this, perhaps we do need to give credit to media as well. Media which has very actively combated stereotypes, which has put forward very positive representation of strong, empowered women too, which I'll come to you, madam, and I would want you to elaborate on this further. So when we do talk about this more so from the media viewpoint, we also understand the fact that your department is producing this drama which is in the making currently, more so one which focuses on this issue of overpopulation. So overall, if you were to then analyze, what do you feel is that one most effective mechanism of, you know, perhaps fostering greater empathy, greater awareness regarding this very issue? Is it just then, of course, limited to mainstream media, or does it also by that virtue extend to social media platform? Because we do see now and then, you know, of course, social media platforms, be it Facebook, be it Twitter, be it Instagram, or even TikTok, they have actually advocated for such important social causes. So why not, you know, issues like these?
I think this is an age of communication, and we are also tapping the benefits of social, digital, electronic and print media.
Right.
Currently, we are producing plays which revolve around the theme of family planning, son preference, all the myths and misconceptions attached to family planning. They are all being covered, but our day-to-day communication, I think that also deserves an attention, because it is continuous, it is non-stopping, and it starts from the clients who walk into our centers as high as national media. So on all the TV channels, which are now so many, earlier we used to have PTV only, but now we have the benefit of dozens of TV channels and lots of
So you are
newspapers.
collaborating with the private sector?
And private sector too.
Of course.
Yes. So we are tapping the potential of all these sources of communication, and the private sector, of course, has its own, you know, liberal
Right.
policies.
Right.
So we are working with all and collaborating with NGOs, with multinationals,
With international partners too.
with international partners too. Then we
Right.
are also recently implementing a World Bank sponsored Punjab Family Planning Program. And we are not alone, like Population Welfare Department is collaborating with the other government departments like Primary Health Department for Government of Punjab.
Right.
And then we are also closely working with other population welfare departments in other provinces, because the population problem is not just for
So it's an
Bondi.
intra-province collaboration, so to
Absolutely.
speak. And then also by that virtue, I feel that it's just not about then, of course, collaborating through media campaigns. It should also equally extend through text messaging or those mediums which reach out to the masses, that too on a very, you know, extensive manner on an everyday basis, so to speak. And that again should be done in words or a language which is very easy to comprehend, perhaps using visuals for people who are not literate that way. In this regard, Saima, do you not feel that when we do talk about educating people about this very issue, about the need to have a family, which of course you can not only support better, but who you can give an optimum quality of life to, it is also important to teach people, the masses out there, the importance of media literacy, because a lot of times we see that in cases more than one, people perhaps might be misled by wrong information that they come across, by fake news, by misinformation, by disinformation. So do you not feel that that again is a very pressing concern that we do need to address vis-a-vis addressing this issue too?
Yes, Fatma, that's a very, very burning issue. We have this burning issue that fake news, fake messages have been conveyed, but media is playing a very, very vital role. Immediately they take a step. Whenever somebody puts up a wrong message or something, media takes over that. But now the awareness is there. You should always respect the country context and the cultural and religious sensitivity as well.
True.
So whenever any sort of messages are being generated or being created by any sort of agencies or any government agencies, these focus should be there, because the media is the channel who spreads the message. So whenever we are using these sort of messages to spread to the massive, we should be very careful about the cultural sensitivity as well. It should not be disrespectful to anybody, and harsh language should not be there. Like just an example, we're focusing on family planning. People don't like talking about family planning. You should just you know, soften it up by using mother and child health, by focusing on child nutrition.
And also in this regard, taking different stratas of the society along, be it religious leaders, be it the community
scholars.
at large, be it for that matter even celebrities, be it social media influencers, so to speak. So the impact is just there. Sir, I'll come to you. I think another issue that we must delve upon during the course of today's conversation is the fact that we see a lot of times in the Pakistani society that women might be opting for, you know, having smaller families, but that too after having a few children. So looking at this from your own public health perspective, how do you feel can we then actually encourage women to seek such services or family planning, that too at an early stage? Because, you know, they say it right when they say that early intervention is the key.
Yes, and if you see even WHO, they recommend healthy timing and spacing for the pregnancies.
Right.
And they have made up protocols, and they recommend that there should be interval of at least 18 to 24 months between the pregnancies. And even after miscarriage, the lady should wait at least for 6 months to get conceive again. And if you see even in the perspectives of our religion Islam, it also teaches that the mother should at least feed for 2 years to the baby.
Right.
And if you see, the best contraceptive method is the exclusive breastfeeding, provided it is being carried out in a proper manner.
Right.
And this gives you 100% contraception at least for 6 months before the child start babying.
Right.
So if we follow these all instructions which is given by the WHO and even our religion, I think the situation can improve.
Right. So, but then do you not feel this has to be then supported by the system itself per se? For example, then we also need to ensure that people have timely and affordable access to the health infrastructure. A lot of times we see that women, perhaps those who belong to the rural and the remote areas of the countries, they might be in need of such family planning services or advice as regards to their reproductive health, but they might not be able to reach out to any healthcare professional, so to speak.
Yes.
So in this regard, do you feel the solution then lies in facilitating this access, or do you feel then the solution lies in actually making family planning a very important integral part of community health per se? Because we have seen countries like Rwanda do just that.
Yes, and if you see in Pakistan, we have a high unmet need, even in Pakistan. A problem is this, that at many places the women, they are not even clear from where they can get the services. So to make it affordable and accessible is one of the biggest thing if we want to shorten our unmet need for the women in Pakistan. Similarly, our CPR, we are trying our best to improve our contraceptive prevalence rate, and we have committed under FP 2030 that we are going to achieve at least 50% of CPR by 2025.
Right.
Still it is staggering around 30 to 35. So there are many innovative interventions which have been initiated by the Population Welfare Department, and Ms. Saman will I definitely share with you, like voucher scheme and e-voucher very recently they have introduced. Similarly, our organization, we have built the capacity of our mid-level providers, especially the community mid-level providers, because they belong to the communities,
right,
and the communities have faith in them,
right,
and
it's easier for the community to reach out to them, and
yes,
it's something very relatable for them too. Madam, I would want you to add to this. When we do talk about the challenges, we do understand that the nature of challenges both in the urban as well as in the rural context, they completely differ. In the rural area, something we had just mentioned, a very present challenge for people might be to access the healthcare system, but when we talk about this in the urban context, there might be not one, rather various socio-economic disparities, so to speak. So in this regard, overall, if you were to then evaluate the challenges that perhaps people like yourself, that the government does come across, how would you then bifurcate those to be, and how do you propose can we actually overcome these challenges so as to very categorically and in a very focused manner overcome this issue of overpopulation?
I think if we look at the budgets being spent by all the provincial governments, there is a phenomenal increase in terms of budgeting, and that budgeting is also being used for the improvement in mother and child health, as well as expansion of services. So if we look at the health department of Government of Punjab, as well as population welfare department, we are focusing on expanding our service network, creating new family planning centers, increasing the number of mobile camps that we are already conducting. And there is a strategy behind camps. We always try to reach out to that community, which is probably located at a point where there is no permanent facility of the government.
Right.
So that no one is outside our circle. And number two, marketing of our services. I think we are currently focusing on that so that people know that there is a department, there is a center available where they can walk into, and an efficient staff would welcome them.
Right, and then you also need to publicize all this so that people know where exactly is your office or your center place and how people can reach out to you. Saima, I would want you to add to this, but more so from a women-centric, perspective. Now we do see that statistics show that, the more the educated a woman is, the more the economically empowered she is, the greater the autonomy, we would like to believe at least, she has over such decisions. So overall, when we do talk about, overpopulation impacting gender inequality or women empowerment, where do you see that link? Why do you feel is it so important for us as a society to educate women to ensure that they are economically empowered so as to combat this very issue?
Well, I always believe in this line that empowered women, empowered families. So educating women, and especially in regards to their policies, especially in regards to Child Marriage Act, reproductive health rights, is very important. So educating them, and we need to tell them that it's not only family planning, it's again their their health which is concerned, their child health which is concerned, and above all we are focusing on economic development as well. So I think that educating women plays a very vital role, and we need to focus on that. And
it is the need of the hour.
It's need of the hour.
Madam, how would you comment on that? Would you agree with this finding?
Yes, I totally agree, because there is an evidence wherever there is gender-based violence and women are persecuted or beaten, there are more kids.
Right, basically, because then you see it makes them more vulnerable to perhaps having a greater family or a bigger family, so to speak.
There can be multiple factors which we can explain, but this is true.
Right, so there is a link that way too. On which, sir, I'll come to you, and before we conclude today's show, so my last question to you would be that when we do talk about working and of course taking overpopulation very seriously, it's very important to also consider this issue in the context of early and child marriages. So in this regard, sir, how do you feel can interventions with regards to early marriages, having more effective laws so as to then curb child marriages, also help us, then combat overpopulation in the larger picture?
Yeah, this is one of the very core issue. If you see in Pakistan, early marriage was normally, this was a tradition in many part of our country, and government has very rightly have taken up this issue, and they have fixed the age of at least 18 years, both for boy and girl to get married. But still there are adolescent pregnancies that are taking place, and around 7 lakh pregnancies between the age of 15 to 19 girls they are taking place each year in Pakistan. And at this age, this girl, she is not prepared to bear the burden of the pregnancy. Their economical, their even body structure is not yet built up to go with a pregnancy burden at a later stage. So I think implementation at the government level, they are serious, and I hope that with the implementation of the bill and implementation on the ground, where government has even introduced the punitive action for those who are not taking it seriously.
So we do have laws in this, and I remember Sindh was perhaps one of the first province which actually brought in law, although law in Punjab is still in the making. We do have a Lahore High Court judgment person to which all this effort was made to actually align this law. But then again, you see a lot turns on the societal mindset, because we do have laws for so many issues. At the end of the day, it all comes down to how the society at large actually interprets them. Madam, coming towards you and talking about this from the government's futuristic viewpoint. How do you see overpopulation finding its way in the government's agenda in the years to come? Yes, we do understand that your department has been working on this in the form of effective service provision, in the form of running not one, rather various mass media campaigns. But what more can we expect from the government in this regard, and what more, in your opinion, should be done so as to overcome this issue?
I think number one thing is that we must all realize that population is growing day by day. So all the policy makers and practitioners and politicians, they must be sensitized. So we do that advocacy part on the part of the department. But we need to realize that these are all voluntary choices. We can only educate a couple, we can only sensitize a family. But what is the role of communities? Themselves and the individuals. I think they need to take care of their wives. Wives also need to take care of their families. So this is how it is so interconnected.
And then education also needs to start at a very early level, and it should also by that virtue extend to before the couple gets married, because a lot of times we see that this counseling is something which then becomes relevant post the marriage. It should ideally be premarital counseling, so to speak.
So I think taking example from the international world, we have also revolutionized our policies. Now we are doing premarital counseling. That is a concept that maybe a man should go for a blood test before actually ending up in marriage. And it is also about understanding the rights and obligations of a couple, couple to be. The second thing that department is doing is expansion of the services so that we can cater to the unmet need. And the third and the, I think, most important area, that is the social behavior change communication, which we are taking very seriously. And here I would also like to mention the Chief Minister of Punjab, where she is the lady herself, and coming into power and becoming the Chief Minister is a symbolic gesture. And she is also taking it seriously. So the narrative for women empowerment.
That's very rightly put by yourself, madam, because then of course when we do have a women leader, we can expect, you know, more women-centric issues to be brought to the table. It does bring in that very much needed women perspective to so many issues relating to women's employment, to their education, or generally ensuring women's access to the public spaces, on which I'll come to you, Ms. Simon, before we conclude today's show. So my last question to you would be that when we do talk about the way forward, do you not feel here that we need to time and again actually emphasize on us to actively collaborate, to have very comprehensive, to have very well thought out collaborations, that too not only between the government and the private sector, but also between the government, the civil society, international partners and Pakistani media, so to speak?
Well, in order to address this ticking bomb population, we need to understand that we need a holistic approach. For holistic approach, we want a multi-sectoral approach as well. For that, all departments, NGOs, INGOs, international stakeholders, government, the policy makers, the influencers, the religious leaders, and above all, the youth and media, they all need to collaborate, because we need to understand that there are 250 million heart beating for one nation, and we want all of the life to live. For that, we need to not only concentrate on the population as a goal, but we need to focus on the environmental degradation and sustainable development goals, which we made some international commitments in the international forum as well, that we have to achieve the SDGs. And all SDGs are linked with each other, like SDG 3, which is like for the well-being, health, women empowerment, infrastructure, they all are linked. And with the increase of population, these all are getting affected. So if all these departments and all, we don't achieve the holistic approach, and we all don't unite to address this issue, then I'm scared that this is going to be alarming for the future.
Definitely, right, basically. And of course, it is then putting the lives of so many young people, of children, of even adults, so to speak, at stake, because overpopulation at the end of the day, in the broader picture, is also a human right violation if you come to think of it from an international perspective too. On which note, I would like to conclude today's show. Thank you so much, sir. Thank you so much, Ms. Saman, and thank you so much, Ms. Saima, for your precious time today. Well, to conclude today's show, we generally spoke about overpopulation more so from a socialist perspective. We also spoke about the fact that why is it so important to then address this issue, that too from a very holistic approach, where ideally as a society we must then of course engage the government, the civil society, international partners, and of course the Pakistani media to work on this issue collectively and together. It's very important that if we as a Pakistani society are serious in curbing this very issue, then we need to not only educate people, but we equally need to sensitize them too about the implications and of course the consequences of overpopulation, and of course about the very pivotal need of sensible family planning. Thank you for watching The Society. Until next time, take care and Allah Hafiz.